if we think that there is an ovarian cancer, how do we get to that stage? And what is the difference between stage and grade? I get that question all the
Yeah.
time.
Yes. No, I think that's a great question. Gets into a little bit of like the technical side, which I think is sometimes important because I think patients obviously have access to their medical records. Sometimes you'll see like a report that comes up in your health records, and you're like, how do I decipher all of this? And so, stage, as you described earlier, really describes like where is this cancer located in the body, and it helps us gauge what our treatment choices are, and helps your physician decide about how help to kind of best talk about outcomes for patients. One of the staging systems that's a little bit more complicated is really trying to use base the understanding where the cancer is based on three factors. One factor is something called T. So it's called a TNM system. So one is how large is the tumor? So that's the T part. One is has it spread to nearby lymph nodes, which is the N part, and then has it spread to other distant sites? That's the M part. So we kind of use that as part of the pathology report. And the TNM also corresponds to the stages we discussed earlier, which were sort of stage 1 or 2, more limited to the pelvis, or stage 3 or 4 in a more advanced stage. So again, I think there are different patients who want to have all of this nuanced information, but it's important to know like what information will be combined. As an example, sort of a stage T1B, that means the tumor was located in both ovaries, but confined to that area. N0 means that the stage had not spread to nearby lymph nodes, and M0 means that the cancer had not spread elsewhere. So then these T and M values are combined to give us the stage 1B. So again, it's not that we want to focus on the numbers or the stages, but just so that you have a little bit of a window into like what we look at when we do surgery and we get a pathology report back. So I think when you do have that situation, talking to your doctor about say, hey, look, here's my 5-page report. How do I translate? What does that mean for me? I think is an important phase. Grade refers to what do the cells look like under the microscope. So most epithelial ovarian cancers, the majority of them are going to be high grade. So sometimes people hear the word, I had high grade ovarian cancer. There are low grade ovarian cancers that are also epithelial, but then there's a whole slew of other cancer types that may also be either low or high grade. In general, a grade that is higher can sometimes have cells that are behaving a little bit more aggressively.